Okay, let's talk about diagnosis of MI. So, diagnosis of MI in the first 6 hours, ECG is the gold standard. Cardiac, cardiac troponin I would rise after 4 hours, would peak with 24 hours, and increase for 7 to 10 days, more specific than the other protein markers. CKMB, on the other hand, would will increase after 6 to 12 hours, would peak with 16 to 24 hours, and predominantly found in myocardium, but can also be released from skeletal muscles. It is useful in diagnosis for re-infarction following acute MI because levels return to normal after 48 hours. ECG changes can include ST elevation, which is seen in the transparent infarct, or ST depression, which is seen in subendocardial infarcts, or hyperacute peak T waves, or T wave inversion, or pathologic Q waves, or poor R wave progression, which is an evolving or old transmural infarct. Looking at this on the right side, what do we have? We have multiple of upper limit of normal on the y-axis. X-axis is the days after MI onset. And let's just draw this as a table. So first of all, we have EKG. EKG is done immediately after the patient presents in, immediately. Duration of no, there is no duration in EKG, right? So EKG can show us if you have an ST segment elevation or Q wave or over days to weeks. That's the duration. The second thing we can do is check on this CKMB and troponin. So let's just put CKMB. CKMB, you will see CKMB in the blood after 6 to 12 hours. It will peak in less than 24 hours, and it will stay abnormal. Duration of abnormality, it will stay abnormal for 48 hours. After 48 hours, it will come back to normal. So till 48 hours, it's going to stay abnormal, right? And for troponin I, TI, I'm just going to mention that. This TI you will see this TI in the blood after 4 hours of MI. It will peak in or at 24 hour, and it will be abnormal for 7 to 10 days. Okay. So because this guy, CKMB, it is coming back to normal within, let's change color actually. Because CKMB is coming back to normal within 48 hours, so we can check this one. Check this for reinfarction. That if you have a reinfarction of your cardiac tissue, you can see the elevation of CKMB and say, hey, it's going back up again. So that means that you have a reinfarction. Because troponin I is already elevated for 7 to 10 days after the infarction started. But now some studies suggest that even then you still repeat the troponin for reinfarction. But I guess for the board purposes, just remember CKMB, they check for the reinfarction. But they do also repeat T. But since your book is mentioning here CKMB as a reinfarction, so just remember that. Okay. So again, the timing is very high yield. What is the timing? EKG should be done immediately right away. That's the must. The first thing you do is EKG. The second thing you do is look at troponin levels, right? Troponins are good. They will come in blood after 4 hours. higher. They will come in blood in a very high level after 4 hours. Okay, and they will peak. This is the peak in 24 hours, and they will be there. They will peak at 24 hours, and they will be there for 7 to 10 days. While in CKMB, will come out in 6 to 12 hours in blood, will peak in less than 24 hours. I mean, if you look in here, it says 16 to 24 hours. Just remember, in less than 1 day, they will peak. Make life simple. In 48 hours, that's the max. After 48 hours, it can go back to normal. So 7 to 10 days go back to normal, 48 hours go back to normal. And that is all for the diagnosis of a myocardial infarction. Now let's look at the actual ECG localization of STEMI. So what do we have here? In this, it's very simple. And this is just the ECGs are localized, and you'll see here ECGs are localized towards the leads, which arteries infarcted and which lead it causes the problem in. And that is all for the ECG localization.